Before I start, thank you, Dr. O.P. Yadav, for your really wonderful speech. Yes, man, including woman, is a social animal. And this element is missing from our curriculum. It should not only be taught for medical students, but also in law colleges, because I come from a legal background. And also engineering colleges and all other specialities. Thank you once again. Dr. O.P. Yadav, Chief Executive Officer and Chief Cardiac Surgeon, National Heart Institute, New Delhi. Dr. P. Chandrasekhar, Vice Chancellor, Dr. NTR University of Health Sciences. Members of the Executive Council, members of the faculty, administrative staff, donors and guests, Secretary to the Governor, my dear students and recipients of degrees and medals in today's convocation, and their proud parents, members of the media, ladies and gentlemen, Andiriki Namaskaram. It gives me immense pleasure to be here amongst you all at the 27th and 28th Annual Convocations of Dr. NTR University of Health Sciences as Chancellor of this esteemed university. I am glad to know that this institution is striving relentlessly to realize its vision and mission statements for the past 4 decades and moving in right direction. On the auspicious occasion of today's convocation, I would like to congratulate all the graduating students, their parents, faculty members and administrative staff. You have certainly demonstrated the commitment, creativity and talent needed to succeed in your chosen career. I sincerely hope that after recognition of your academic feat, your hard-earned knowledge enables you to lead the life in the best possible manner and to serve the society by providing comprehensive health care. I also congratulate Dr. O.P. Yadav ji, esteemed Chief Executive Officer and Chief Cardiac Surgeon, National Heart Institute, New Delhi, who is being conferred the honorary doctorate of NTR University of Health Sciences here today. I think he deserves much more, my dear friends. Andhra Pradesh has always been in the forefront of healthcare sciences and medical education. And we can proudly say that the University of Health Sciences, which was established in 1986, was the first of its kind in the country. This was the first umbrella university, if I am right, in the country. On the medical education front, our state has been making rapid progress compared to the rest of the country and South India. Today, Dr. NTR University of Health Sciences has under its jurisdiction as many as 580 colleges offering medical, dental, Ayurveda, homeopathy, Unani, naturopathy and yoga, nursing, physiotherapy and other allied healthcare courses, providing training to thousands of students in various branches of medicine and allied healthcare. Healthcare profession is the noblest of all professions, and you are all indeed fortunate to be the chosen few in this profession. But Dr. Yadav has already warned you how you should be. To achieve success while delivering healthcare, both curative, promotive, and preventive, you must work hard with sincerity and commitment. Critical thinking and scientific analysis are supporting pillars for evidence-based medicine in advancement in research. To encourage research, the university is contemplating to give financial assistance with special emphasis on PhD programs. It has identified over 23 centers and 361 PhD guides amongst the affiliated institutions of Dr. NTR University of Health Sciences for the purpose. With a view to encouraging more research work in medical and allied sciences by motivating the students at the undergraduate level to step out with new inventions and to discover long-lasting solutions for issues that have not been addressed in the field of medical and allied sciences in accordance with the changing lifestyles in food habits, the university has introduced research scholarship for undergraduate students in the name of Undergraduate Student Research Scholarship to award research scholarships to 500 students every year. I am glad to know that this program is being introduced in the colleges in near future. I am delighted to know that the university is conducting quarterly PG continuing medical education program in all affiliated PG medical colleges to enable the students and teaching faculty to update their knowledge from time to time, for which a financial assistance of rupees 25,000 per program is being provided. It is interesting to note that APMC issues 2 credit hours for each CMI. I am also informed that university has started 2 new courses in clinical psychology, that is MPhil and PDCP, with 6 seats each. One new medical college has been functional in the remote tribal area of Paderu in Visakhapatnam district, in addition to 34 existing medical colleges in the state. Action has also been taken to fill vacancies in various categories of medical and health department over the period. Postgraduate medical courses in the specialties of anesthesiology and radiation oncology have been functional at Homi Baba Cancer Hospital and Research Center, Visakhapatnam. My dear students, I would like to congratulate the students who are receiving their medals today under various categories for their excellent performance, and the students who are receiving their graduate and postgraduate degrees, and the research scholars who are receiving their PhD, super specialty and post-graduation degrees. As you all are aware, in a profession that deals with well-being of humans, people have expectations of services of highest order from you, untainted by any tinge of corruption or incompetence. You have entered a field in which you cannot remain contented with your achievements, but must constantly improve your skills by study and research, as the field of medical sciences is rapidly evolving and progressing. You must continue to remain ideal and ethical, unmindful of societal forces that may induce you to act otherwise. Healthcare education today is a difficult and challenging field to enter, and once you enter the college and the profession, You must commit yourself to a lifelong journey of hard work, commitment, sincerity, and education to keep up with the rapid advances in healthcare and to provide health and therapeutic services to all the needy persons. And you should also take blessings from an eminent personality like Dr. Yadav every day perhaps. Unlike other professions, people expect and demand practitioners of medical profession to provide best and unconditional services. You have a fiduciary duty and responsibility towards the society, and you may sometimes have to bear a lot of pain and suffering, and sometimes you may have to sacrifice your personal interests so that your patient may live for another day, or that a family may enjoy their dear ones coming back home hale and healthy. But in the end, the gratitude and affection that you may win from your patients and their family members will give you a soothing experience and relieve you from stress and give you the greatest feeling of joy and satisfaction which no other profession or duty can offer. When I was in a law college, we were told by one of our professors about the fees the lawyer gets. Rich man pays, poor man prays. This is applicable to you also. Rich man pays and poor man prays for you. Recognizing the need to provide quality health care to the citizens of the state, successive governments have been striving hard to ensure availability of qualified healthcare personnel and essential medicines in all government hospitals. It is in this context that the compulsory one-year senior residency has been introduced. I sincerely urge all the budding doctors to readily go forward to serve the underprivileged and give them the succor, while at the same time hone your skills under the guidance and expertise of senior doctors. Dear students, wherever you go, remember that the patients and your institution come first, and then your family and yourself. Right? I'm sorry to tell you this, doctor. After completion of the degree, MBBS, I think there is 1 year or 2 year compulsory service, village service, right? They have to serve. Internship. No. I think they have to go to rural places and serve. It is mandatory, right? Here, what about Andhra? It is compulsory. You have to go to villages. But I request all the authorities. I have heard some shocking news. I am really sorry for this. False certificates are being issued. The students go to their native places and stay there comfortably in their houses. Doctor, I am telling you with all sincerity. Please take care of this, right? Not correct. Rules are made, laws are made for your good, for our good, for the good of the society. From a legal background, I can tell you this. What is law after all? Law is the codified form of common sense. Everybody knows this. Please don't avoid. Common sense says you have to study in rural area also. You should have the experience. Doctor said, man is a social animal. So you should know the animals better, no? In healthcare sector, significant progress has been made both at the national and state level. The center's flagship healthcare program, Ayushman Bharat, covers over 10 crore poor and vulnerable families, providing coverage up to 5 lakh per family per year for secondary and tertiary care hospitalization. At the state level, village health clinics have been operationalized across the state, and a unique family doctor concept is personalized. Home-based treatment has been launched. In addition, we have about primary health centers, community health centers, area hospitals, district hospitals, teaching hospitals, specialty hospitals, and urban PHCs. The advent of technology in medicine has led to remarkable strides in patient care, with robotic surgery and telemedicine being two of the most significant advancements. These technologies have shown remarkable synergy in improving healthcare delivery. The integration of robotic surgery and telemedicine is reshaping the medical landscape, offering new possibilities for patient care. Artificial intelligence is rapidly transforming healthcare, offering solutions across various domains from diagnostics and drug discovery to personalized treatment and patient care. AI-powered tools are enhancing efficiency, accuracy, and accessibility, ultimately aiming to improve patient outcomes and revolutionize the healthcare landscape. Diagnosis and imaging, drug discovery and development, personalized medicine and treatment, patient care and management, surgical applications, enhanced efficiency, mental health are some of the areas which can effectively be managed by artificial intelligence. I would like to remind you again that yours is a profession of continuous learning. And you cannot just rest on your laurels, and must strive hard to always remain at the top by enriching your knowledge and skills to serve the people better. As somebody rightly said, stay curious and never stop learning. The medical field is constantly evolving, and your thirst for knowledge will set you apart as a future doctor. Ancient and classical texts of Ayurveda, namely Charaka Samhita and Sushruta Samhita, are the two authentic texts which were written centuries ago, representing Kaya Chikitsa, that is medicine, Shalya Tantra, surgery, respectively, stand unchanged even today for their originality and quality. Acharya Charaka and Acharya Sushruta have shown the path to achieve the long coveted goals of a long and healthy life. Charaka Samhita, Sushruta Samhita, and Vagbhata Samhita are considered as the most important Samhita of Krita Yuga, Dwapara Yuga, and Kali Yuga respectively. It is included in the list of three mostly authentic Samhita of Ayurvedic science, which are known as Brihatrayi and held in high esteem since many millennia. According to Acharya Sushruta, Vaidya, that is physician, Rogi, namely patient or sick person, Bheshaja, proper drug, and Paricharak, compounder or nurse. These are the four limbs of treatment and responsible for its success. The four factors equipped with good qualities will be able to cure even the great disease within a short time. Please remember our ancient adage, Vaidya Narayano Hari. What do you mean by that? Doctor is embodiment of God. Doctors play an important role in building a healthy society and a productive nation. The health of the people is in your hands. Only healthy people can make a state and the country healthy, prosperous, and productive. Right? Every patient and their family who visit a hospital is worried and concerned about the outcome of diagnosis and its prognosis, whether it can be cured, the costs involved, and the financial burden it will impose on the entire family. A word of kindness, friends or doctors, a word of kindness and a smile from you will regenerate and boost the patient's morale and add value to the effect of medication. Don't be rude, huh? Compassion and empathy towards the sick and their families. Your patience and soothing words will have a tremendous impact of comfort for the disheartened patients who come to you in distress. Please remember the words of famous Swiss psychiatrist Carl Jung, who said, and I quote, please listen to me carefully. Medicine cure diseases. Medicines cure diseases, but only doctors can cure patients. Dear students, I advise you all to practice yoga and meditation for your overall well-being, overcoming physical and mental stress, maintaining good health, and enhancing your endurance. Inculcate the habit of lifelong learning and success will be yours. I once again extend my hearty congratulations and best wishes to all the graduate and postgraduate students receiving their degrees in today's convocation. ఈ రోజు జరిగిన స్నాతకోత్సవంలో పట్టాలు అందకుండన్న గ్రాడ్యుయేట్ మరియు పోస్ట్ గ్రాడ్యుయేట్ విద్యార్థులందరికీ మరొక్కసారి నా హృదయపూర్వక అభినందనలు మరియు శుభాకాంక్షలు తెలుపుతున్నాను. అందరికీ ధన్యవాదాలు.